Um, so as an equine practitioner, I was a member of the American Association of Equine Practitioners, and they have a set of core vaccines that they recommend for horses. And they have Eastern encephalitis, Western encephalitis, tetanus, West Nile virus, influenza, and rhinopneumonitis. And these are what they call their core vaccines. These are what they consider the most essential vaccines for a horse yearly. Now, there are exceptions of how we administer these. Your mosquito-borne diseases, your Eastern and your Western and your West Nile, those in the Southeast are actually pretty important in that we have mosquitoes year-round here. So in South Carolina and the Southeast especially, we have mosquitoes year-round. So we have to change how we give those things in our protocols and what we do. So there are other non-core vaccines, rabies, strangles. When I worked in Virginia, we gave a lot of horses Potomac horse fever vaccines because there are hot spots around the country that you really see a lot of Potomac horse fever. In Northern Virginia, there's a spot out in Western Montana, and there's a spot out in Arizona. And they routinely vaccinate in those areas. But in South Carolina, we don't see it. We might see in a transient horse, which is a horse that travels a lot. He's winters down here, summers up in New York or somewhere like that. And sometimes we'll do that based on where he's going to be, half the year. So for our protocols, what I call my four-way, when I was in practice, I called it my four-way, my Eastern, Western, tetanus, and West Nile vaccination. I administered it twice a year. And if you read the label, if you talk to the drug reps or anybody, they'll tell you once a year. In the Southeast, since we have mosquitoes all year long, we have to vaccinate twice a year for those mosquito-borne diseases. In new foals, young foals, we vaccinate them. The initial vaccine is at 5 to 6 months old. We used to do it at 4, but we found out that maternal immunity in the mares actually lasts between 4 and 5 months. And if you vaccinate a foal and he's still got maternal immunity, you'll actually inhibit the immune system from developing immunity to the vaccine from the vaccine. So we wait on the maternal antibodies to pretty much run their span, and then we vaccinate 5 to 6 months of age. Then we booster that foal in 30 days, and then we come back and do a 6-month booster. After that, we just do it every 6 months. The rabies is once a year vaccine. Some veterinarians will recommend an initial vaccine and then one in 30 days. But what they're finding is that the titers to that rabies vaccine are good after only one injection. So I tend to just do one rabies shot once a year and let her roll like that. The flu rhino throws a little hitch in the giddy up because it depends on what your horse does, how many times we vaccinate per year for it. So if you have show horses and we're showing those horses 2 or 3 times a month or maybe every weekend or even just a couple of times a month, and we're in Perry, Georgia, or we're in Raleigh, North Carolina, or we're in Camden, or we're somewhere where there's 300 or 400 other horses showing, the vaccine, the immunity from the vaccine will last you about 3 to 4 months naturally, maybe 5 or 6. But when you're talking and you get around other show horses that may or may not have been vaccinated, they get exposed to so much, it can overwhelm that immunity. And they can still get flu and rhino even though they're vaccinated once a year or twice a year. So in show horses, we recommend doing that quarterly. And because they're traveling all the time and they need that immunity. In your trail horses that are, out on the trail, they may not be around 50 other horses all day. They might be on the trail with you and their barn mates, but when they get back to the barns and the stables, they're still around other horses. And if you do that very often, like if you go to the Hart Ride that's got 1,000 horses and you go to, Croft or something, and there's 50 horses there in an organized trail ride, 2 to 3 times a year for flu rhino. Pasture horses, because the immunity doesn't last long from the vaccine, we tend to recommend do it twice a year. So when I was in practice, if they got the core set, they would get what I would call a 6-way. And that was their EWT and their West Nile is my 4-way. And then I'd give them a flu rhino. It was 2 different shots, but I charged it out as 1, but that was a twice a year deal just for pasture horses. Because the mosquitoes don't go away and the flu rhino immunity from the vaccine may last 5-6 months and they need another vaccine for it. Other non-core vaccines like strangles, and this is administer the first time, doesn't matter the age of the horse, and then booster it 30 days later and then once a year. And this is for horses in boarding situations. You know, if they stay in a boarding barn where there's 20, 30 other horses and there's a lot of traffic in that barn, horses leaving and coming back. It's not the horses that are traveling that could be your problem. It could be the horses back at the barn that aren't vaccinated. And if the traveling horses have been vaccinated and they go to a show and there's a horse there who's getting over stranglers or just starting strangles and is not clinical, and they bring that bug back to the barn and there's horses there have not been vaccinated, then that barn's going to get strangles. And that can shut a barn down for 4 to 6 months in the worst case scenarios. There's a couple of different strangles vaccines. There's one that goes in the muscle. It doesn't work. It's been proven by clinical studies not to produce much, if any, antibody response to the disease. The most effective is the intranasal. Now, there's a caveat to this. If you have a horse that's had strangles and he might be 6 months out from getting over it, or he might be a year out from getting over it, and you give him the strangles vaccine in the nose, he could develop a condition called purpura hemorrhagica. And that's just a reaction to the vaccine. It's a messy one, but they get over it. And so a lot of times we have to know, a veterinarian will ask, has this horse ever had strangles before? Because once they've had strangles and they get over it, typically they don't need a vaccine because they have lifelong immunity. So we are kind of particular. You know, a lot of guys get a little trigger shy on vaccinating whole barns, especially in horses they're not familiar with, because we want to make sure that horse has never had the strangles disease. And so that's where it gets a little dicey with the strangles. So switching gears to parasites. Well, let me back up. Any questions about vaccines? None? Okie dokie. All right, so we'll move on to dewormers. So deworming and parasites in horses has changed over the last 10, maybe 12 years, in that we do it much different than we used to. When I grew up, we did it one way, and now we've changed. Now, in order to know, what your horse looks like if he's got a high worm load, he will lose weight. They might get, lethargic or lazy, or they have poor performance. And worsening conditions, they'll get diarrhea, they'll get a rough hair coat, and in the worst case scenarios, they'll get colic. Especially if they've got a high worm load and you deworm them with a big, huge, high kill dewormer, they'll kill all the worms and we'll end up with an impaction colic. So the old way of doing it, and I grew up doing this, was that every 2 months we would deworm, and we would, we were preached to by our veterinarians to rotate the product, whether it be an ivermectin or whether it be a Panicure or Strongit or Anthracite, and rotate each one of those. Give them an ivermectin one time, the next time give them a Panicure, the next time give them a Safeguard, or just change your product so the worms don't get immune to it and resistant to it. So now we have a new way of doing it, and it's called fecal egg counts. And your veterinarian is needed to do this, and most veterinarians will send this out to the lab because it takes a special piece of equipment to do it. But you bring a manure sample into the clinic. Typically, it's a fresh one, and you pull off the top of a pile, and they send it into the lab, or they can, some bigger practices like Rid and Reel can process them themselves, and then they'll measure them, and they'll measure how many eggs per gram of manure are in that manure sample. Now, in order to have an accurate reading and an accurate test, you need to make sure you haven't dewormed your horse for 3 months. a minimum of 3 months since the last deworming to get an accurate measure of it. So what is, how do we determine that? Well, horses are designed to tolerate a certain number of worm eggs in their system. Usually it's, 80 or less, or 80 to 100 or less. That is, we don't generally deworm a horse if we count 80 to 100 eggs per gram of manure. We don't deworm those horses. Those are not considered high shedders and not highly infested. In fact, Dr. Kaplan from University of Georgia, who's the parasite guru, says that's pretty normal. That's where they have a good balance. And if the test is over 120 eggs per gram, then we decide that's the trigger point where we have to deworm. And then most of the time, and for veterinarians I've worked for and in my own practice, based on those test results, we develop a deworming program specifically for your horse. It may be, it varies widely, but it's the problem with this is there are no new dewormers coming on the market. There hasn't been any in testing in 5 to 7 years, and there's none in testing now. And it takes 5 to 7 years when they introduce a new dewormer into the testing. It takes 7 years for it to begin to if nothing goes wrong, and that's uninhibited testing, to get approved by the FDA. And right now there are no new products coming on, and we are worried about resistance. We do see some resistance to your safeguards and to different deworming parasiticides because they've been used, over and over again. So rotating or using your eggs per gram and what kind of worms they are kind of determines what we recommend you give them. So one last thing, and I promise I'll be done, is the regulatory part of this, and this is what I kind of do now. Coggins test. Coggins is a test that tests for a disease called equine infectious anemia. And equine infectious anemia is, I make it akin to HIV in people. So HIV in people affects the white blood cells in people. EIA in horses affects the red blood cells. It makes them anemic. Their gums become pale, they lose weight, and it is a slow and insidious disease. It might take, a couple of years for a horse to actually pass away if he has EIA. It is, it's transmitted by biting flies, biting insects. And so years ago, when I was a kid, 30 years ago, 40 years ago, the USDA came out with a test and remove to kind of clear the population in the country of EIA. And so they required the test once a year. If your horse is positive, if it's a gelding, you pretty much have no choice. You have to euthanize that horse. If it's a pregnant mare, they will allow that mare to foal, but before that foal is 24 hours old, they want that foal to get the colostrum, and then they wean that foal and they euthanize the mare, and the baby becomes a bottle baby. So there was a time where you could keep those horses, 200 yards away from other horses, but with prevailing winds, it was determined that flies can fly with a tailwind more than a mile. And so they kind of went away from that, and now it's euthanasia, unfortunately. So it's required once a year. It's required for horses kept in boarding barns and stables once a year. If you're going to a public assembly of horses, and I'll explain what that is in the next slide or two, and then most importantly, if you're coming into South Carolina, you're going to have a Coggins, a negative valid Coggins, and you're going to have that health certificate with it. Same as other states, North Carolina, anytime you cross a state line, most states require you to have a negative Coggins with a health certificate. So what is a public assembly of horses? Number one, it includes shows, fairs, exhibitions, trail rides, rodeos, sales. Anytime you go to a gathering of 2 or more horse owners, not just horses. I mean, if you carry 2 of your own horses to Croft or Kings Mountain or anywhere in the state to ride, and they're your horses and you don't have anybody else, that is not considered a public assembly of horses. If your buddy comes with you and has a horse or two with him or her, that is a public assembly of horses. So anytime you go around horses that don't live together on a regular basis, that is considered a public assembly. So in South Carolina, we have two kinds of health certificates. We have a 30-day certificate, and then we have the new, which started, I think it was this past January, I believe, or December, the 6-month EECVI. EECVI stands for Equine Electronic Certificate of Veterinary Inspection. And it's all online. Right now, it is offered through Global Vet Link, but your veterinarian is involved in that one. And I would recommend, I have a whole PowerPoint about just the EECVI. So, but that requires your veterinarian. It's online and has some responsibilities in terms of when you go places, you have to fill out a few paperwork, but it is good. Duration of 6 months. Anytime you cross state lines, if you're coming into South Carolina, if you're leaving South Carolina, other states are going to require you to have a valid Coggins and either a 30-day or a 6-month health certificate. Now, the exception to this rule is some events, like the Cutting Horse Show in Perry, or excuse me, in North Augusta. Sometimes they will require you to have a health certificate, even though you're coming from South Carolina. It's just because there are so many horses in that place. They want to safeguard against any communicable diseases that might be occurring, and they might want to, some events or competitions require a health certificate as well as a Coggins. And I think that's all we have. That's all